It is very uncommon for a Parkinsonian tremor to be present during postural movements or during activity, although the tremor is usually considerably more intense during rest. This time we will discuss motor symptoms in Parkinson's disease. Parkinson's disease, also known as paralysis agitans, is a progressive neurological illness that affects 100 to 200 per 100,000 people over the age of 40. Parkinson's disease was once thought to be a motor system disease, but it is now recognized as a complex syndrome with a wide range of clinical characteristics, including neuropsychiatric and other non-motor manifestations in addition to motor symptoms. In this topic, we will focus on motor symptoms. The four cardinal signs of motor symptoms in Parkinson's disease are bradykinesia, tremor, rigidity, and postural instability. However, postural instability is not always present, and it usually does not appear until much later in the disease's progression. The most common symptom of Parkinson's disease is bradykinesia, yet it is also the most difficult for patients to explain. The words weakness, incoordination, and tiredness are frequently used to characterize the inability to begin voluntary movement. It is the primary cause of disability in Parkinson's disease and eventually can be seen in nearly every patient. Bradykinesia in the arms generally begins distally with reduced manual dexterity of the fingers. Patients frequently complain about difficulties buttoning clothing, tying shoelaces, double-clicking a computer mouse, typing, or lifting money from a pocket or purse. In the legs, bradykinesia's frequent symptoms during walks include dragging the legs, taking shorter steps, or feeling unstable. Patients may also have difficulties getting out of a car or rising up from a sitting. Gait freezing and festination may emerge as the illness develops. Festination is an uncontrollable desire to take much quicker and shorter steps and to forcibly take a running pace. Bradykinesia clinical assessment requires observation of limb movements on both sides of the body, such as finger tapping, hand opening closing, pronation supination hand motions, and heel or toe tapping should be closely monitored for speed, amplitude, and rhythm. When examined for more than a few seconds, these activities generally indicate some slowness and reduced amplitude in moderate Parkinson's disease. Movements become less coordinated as the illness advances, with frequent hesitations and stops. Next is tremor. The tremor in Parkinson's disease is a rest tremor, which implies that it is most obvious when the tremulous body part is resting and doesn't participate in intentional activity. The frequency of the tremor in Parkinson's disease ranges between 3 and 7 Hz, with the most common frequency being between 4 and 5 Hz. Tremor often begins unilaterally in the hand and extends contralaterally several years after symptoms appear. Throughout the course of the condition, the side that is initially affected tends to be the more affected side. In contrast, tremors in other diseases, such as essential tremor or multiple sclerosis, are usually action tremors, which occur when the affected limb is utilized. It is very uncommon for a Parkinsonian tremor to be present during postural movements or during activity, although the tremor is usually considerably more intense during rest. Some Parkinson's disease patients may have a re-emergent tremor, which is a postural tremor that appears after a delay of several seconds and has a frequency similar to the rest tremor in Parkinson's disease. Tremor in the limbs can be noticed in the clinical environment when the patient is relaxed and the hands are resting gently on the lap. Distracting the patient with mental calculations or purposeful repeated motions of the contralateral limb frequently worsens a mild tremor and may reveal a latent tremor. The tremor of Parkinson's disease can affect the legs, lips, jaw, and tongue, but seldom the head. Anxiety, emotional excitement, or stressful events can all aggravate tremors. Next is rigidity. Rigidity is an increased resistance to passive movement around a joint that occurs in about 75 to 90% of Parkinson's disease patients. Rigidity, like tremor and bradykinesia, often starts unilaterally and on the same side as the tremor. Rigidity gradually spreads to the contralateral side and stays asymmetric throughout the disease. Cogwheel rigidity may be observed in Parkinson's disease, and it refers to a ratchety sequence of resistance and relaxation when the examiner moves the limb through its entire range of motion. This is believed to be a tremor overlaid atop enhanced tone. However, not all Parkinson's disease patients exhibit cogwheel stiffness. Many instead have lead pipe rigidity, a tonic resistance that is smooth across the full range of passive movement. Rigidity causes features such as the striatal hand, an extension of the proximal and distal interphalangeal joints with flexion at the metacarpophalangeal joints, reduced arm swing while walking, and the characteristic stopped posture. Rigidity is evaluated at the bedside by passively moving the limbs. It may be brought out by having the patient do repeated movements with the contralateral limb. The last one is postural instability. Postural instability is a dysfunction of centrally mediated postural reflexes that causes a sense of imbalance and a tendency to fall with a high risk of injury. Clinically, postural instability is assessed using the pull test, in which the examiner stands behind the patient and forcibly pulls the patient by the shoulders. Patients with appropriate postural reflexes should be able to maintain balance and take no more than one step backward. Patients with Parkinson's disease with postural instability are more prone to fall or take many steps backwards. Initially, a positive pull test may be the sole indication of a balance problem. However, when postural instability worsens, the gait may become festinated. Patients who have lost their postural reflexes are usually wheelchair-bound. If you find this video helpful, please hit the subscribe and bell buttons. And don't forget to like and share this video. Thanks.